A very good afternoon, dear friends, and welcome you all to this segment on irregular periods by BabyChakra. I am Dr. Sandhya Saharan, the president of the Obstetrics and Gynecological Society of Thane District. I welcome you all to this important topic as it affects more than 40 to 50% of women whom we see in our practice. At the outset, I'd like to acquaint you with myself. I have been practicing in Thane and Mumbai for the past 28 years, having done my post-graduation in obstetrics and gynecology from the KEM hospital, as you must be conversant with this illustrious institution. And I have been also trained in endoscopy and IVF in the US. So I see a lot of patients at all my consulting rooms at the Jupiter Hospital, Thane from 5 o'clock onwards. Afternoons, I consult at the Kaushalya Medical Foundation Trust Hospital at Panch Pakhadi, Thane at 12 o'clock on Monday, Wednesdays, and Fridays. And I am also available at the Hiranandani Hospital, Thane on Tuesdays and Thursdays. I shall share my email ID with you, Sandhya Saharan, SANDHYA SAHARAN @gmail.com. And you can also follow me on Facebook on DOCTOR Sandhya Saharan. So this is my brief introduction. I write a lot of articles. I attend conferences. I teach. I have lovely publications and a lot of papers to my credit. I'm also an internationally accredited speaker. So without much ado, I'd like to go on to this topic on 5 tips to overcome irregular cycles. Now, as we all know that the monthly cycle, which we call periods, are basically an interval of 28 days normally. But this 28-day interval is not consistent in all women. A lot of women face irregularities, which is basically defined if you get a period of a lesser than 21-day interval or more than 35-day interval, then it is termed as irregular. There can also be things like intermittent or intermenstrual spotting, that is bleeding in between periods. That is also an irregularity. A lot of women complain of extremely heavy bleeding, which can be, say, more than 3 pads. These things also need to be addressed. So what do you do if you have irregular periods? First and foremost, one has to remember that periods start at the age of, say, 12 or 13. We call it menarche, when you attain your first menstruation. Once you attain menarche, the periods will be a little irregular for a couple of years because the hypothalamo-pituitary axis, that is the brain as well as the pituitary coordination with your ovarian axis, takes time to develop and it takes time to stabilize. The periods are governed by this axis and there is a rhythmic control. So for first 2 years, if you have irregular cycles, then you should not worry. It will stabilize over a period of time. But if it continues beyond 2 or 3 years, then you need to be seen by your doctor or gynecologist. Now, what you need to remember besides this? If this pattern continues for a longer time, then definitely we rule out other problems. There are lots of issues which we take into account when we get patients with irregular cycles. First of all, what is their history? Any history of any illness? Which are the illnesses which we need to rule out before we address you as a hormonal imbalance or a physiological irregularity? Now, what are the pathological diseases which mimic irregular cycles and which cause irregular cycles. In our country, anemia is a very important cause. You may be having a very low hemoglobin. And so if you have anemia, you will get less bleeding or maybe a longer interval in between your cycles. Sometimes it can also cause heavy bleeding. So that is number one. Second is polycystic ovarian syndrome. When there are small cysts which form in your ovary, which is a hormonal imbalance, it is caused by an endocrine disorder. So this needs to be ruled out because it is affecting more and more girls now. And we see a lot of associated hirsutism, acne, irregular periods, and also irregular ovulation. This is one factor to be kept in mind. Then other diseases, hypothyroidism, again, very much on the rise. So this needs to be ruled out. And diabetes, any infections in the pelvis. See, a lot of girls get a lot of vaginal infections, genital infections. They can also cause irregular periods. Sexually transmitted diseases or AIDS. Now we know in older women, or if there are even promiscuity, which we see, then we have to look out for any sexually transmitted infections. So first and foremost, a history taking is what we do, in which we ask you if there is any family history. When your mother, did she have irregular periods? Did she have polycystic ovaries? Is there any diabetic in the family? Any malignancies in the family? Very important to rule out uterine, ovarian, breast cancers in immediate family, that is maternal family. So that is another thing which you need to keep in mind. There are many local causes. See, within the uterus, sometimes in women who have undergone multiple abortions, who undergo multiple, we call DNCs, that is curettings, they also can develop something called adhesions, that is small kinds of, curtains within the uterine cavity, and that is fibrosis, which causes very less bleeding. Tuberculosis of the uterus is a very important factor which causes very scanty periods. In our country, again, tuberculosis is huge. So we have to remember all these things. So as a doctor, what happens is we first rule out all these conditions and then we try to pinpoint the cause. So you will be asked a detailed history, a family history, whether you've undergone any surgeries. Most importantly now, a personal history. Now, personal history is what I need to stress upon because this is what plays a very important role, whether you have any habits like smoking, alcohol, or drug abuse. Very important because they have a direct bearing on your periods. Stress. Everybody is under stress, right from a school-going child to old age. Stress is a part of life. This definitely alters your cycles. So remember, these things need to be addressed, but then stress, the level of stress is different in each individual. The capacity to handle stress is also variable. So these are important factors which we have to rule out. What kind of exercise are you doing? Whether you're into sports, endurance exercises, whether you are sedentary. So everything is taken into account. We see what is your weight. Very important. Calculate your BMI. Now, what is BMI? Body Mass Index. Body Mass Index is calculated by a simple calculation, your weight in kilograms divided by your height in meters square. Okay. So if we measure the height in centimeters, you first convert it into meters, then you square the meters and you divide your weight by that. If your BMI is more than 23, then you are labeled as overweight. And if it is more than, say, 25, then you're obese, and more than 30, you're morbidly obese. So you have to see that your BMI is in control. Then next is, what is your sleep pattern? Are you sleeping well? What is your diet? Whether you are taking a proper diet, healthy diet, or whether you're just binging on food, or whether you're eating junk food. So now I go on to the 5 tips. Since I have told you what is the background, first of all, for any disease or any abnormality, first you have to identify the cause. Once you identify the cause, you have to find out ways to circumvent the problem. So tip number 1, first, if you have any consistent irregularity which warrants medical attention, then please see your gynecologist. I have just enumerated all the reasons which can cause it. Secondly, if you have a weight issue, maintain a diary, see what you eat, calculate your calories. Try and follow a healthy diet and lifestyle pattern. And if you're exceeding, say, 1200 calories, then you see where you're going wrong and take the help of a calorie counter and count your calories and stay healthy. Try and inculcate a structured lifestyle, incorporate some discipline in your life. Yoga, meditation goes a very long way in battling stress and many other health issues, especially chronic illnesses. Depression and anxiety is something which is very common. So try and maintain a positive attitude to life. Water intake is extremely important. Drink lots of water. Do not drink aerated drinks. Do not drink all these fizzy drinks, but try and have water or coconut water. Very, very important. When you exercise, try and see that you get adequate vitamin D. That is, try and stay outdoors at least for, say, 20 minutes or 25 minutes between 10 a.m. and 2 p.m. This gives you the required amount of vitamin D, which maintains your bone health and calcium metabolism. And avoid self-medication. Do not eat junk food. Do not give in to temptation. Do not try any substance abuse, and do not self-medicate. So I think these are the important parameters which will go a long way in seeing that you have a normal menstrual cycle. So I think if there are any questions, I would be more than happy to answer them. And I would be glad to address your issues. So Padma has written to me. Irregular periods I am suffering for the last 2 years. Please tell me what solution I can do. Padma, I'd like to ask you, what is your age and exactly how irregular are your cycles? If you could tell me that, I would help you. Okay, now as I said, the age is important. If you are less than 15, then you just wait for a couple of years, the periods will settle down. If you are overweight, then definitely the excess of weight is going to convert to estrogen and to the male hormone androgens, and you are going to have problems with weight. So overweight is definitely a problem, Richa, and you cannot just say, is Meprate safe to use for irregular periods? See, do not try and self-medicate, as I said, only if you have been prescribed a particular medication, only then you have to take it. And once a gynecologist or your doctor prescribes you, then you have to discuss the pros and cons of that medication. Many medicines have multiple indications, so they are given for a specific condition. So we cannot say whether it is safe for this or for that, but medication should be taken only under supervision. Yuti, what blood tests do they do to rule out PCOS and hormonal imbalance? I have got irregular periods. Now, Yuti, this is an important cause. Like I said, PCOS is very important. We have to see whether you have any diabetes in the family. What is your fasting blood sugar level? We also do something called a glycosylated hemoglobin level, which gives you a glucose control within the last 3 months. So it is a very important test. We need to calculate your BMI. If you are older than 18, then we get a baseline sonography done to see whether you are fitting into the criteria of multiple follicles in the ovary. There are specific sonography criteria. So that is something which we see. And also sometimes we do hormonal tests. There are 2 hormones, luteinizing hormone, follicle stimulating hormone. We rule out thyroid problems. we do your prolactin level, which is a hormone which governs your ovulation, and it has an impact on the proper functioning of the hormones which are responsible for periods. So these are the basic investigations which we do. If you are having a lot of hirsutism, then we do your male hormone levels, that is testosterone levels. Otherwise, these are more than till you have gross diabetes or there is some factor which suggests the need to do so. Now we have one more question from Usha. My blood test and scan report is normal. Last month I got my periods on the 10th September and I'm still bleeding today. Doctor gave me a particular medicine for 7 days. My bleeding is not stopping. So you, Usha, you definitely need to see your doctor and ask as to why the periods are not stopping. Sometimes you need a longer medication. Sometimes you need a different molecule. So these cases which are under the supervision of a doctor need to be seen by that doctor. You have to follow up. Only then it will be possible to treat you. Pratibha, doctor has suggested No.1 for 21 days from the 3rd day. Taking it, will it reduce the heavy bleeding, whether to take it or not? Pratibha, if your doctor has given you No.1, then you must have asked certain things, or whether it is for contraception or if it is for a bleeding problem. It can be used for either because these are hormonal pills. So these have multiple effects. Yes, No.1, any hormonal pill, which is a combined hormonal pill, does reduce the amount of bleeding. It does. But whether you should take it or not depends on what indication you're taking it. And if your doctor has given you, then I think you should discuss with your doctor and then you should ask all your doubts and you should be convinced, and only then you can start. But you please be free to ask all your questions to your family practitioner. And last question, we are done with all the questions. So I hope I have addressed your queries. And if you have any further questions or if you feel the need to get in touch with with me, then you are most welcome to email me at sandhyasaharan@gmail.com or on Facebook, DOCTOR SANDHYASAHARAN. I'm also there on Instagram, Dr. Sandhya Saharan. So it's been a pleasure to be with you all, and I hope you all the best and enjoy your Navratri festival, which is coming up. Thank you, BabyChakra, for this beautiful opportunity.